1 मिनट लगेगा। आई थिंक उसके बाद चेंज करने में कोई मसला तो नहीं होगा, राइट? होस्ट। I think we are live on YouTube.
So हम start कब करें then?
तीन बजे हम इंशाल्लाह स्टार्ट करेंगे।
Okay, perfect.
Yes, we are live now.
Should I start? We have 2 minutes.
Yeah, just
Yeah.
wait 2 minutes. Just wait for now.
Okay.
Omar, whatever you decide, inshallah, just let us know.
नहीं सर हम पूरे 3 बजे स्टार्ट करेंगे वक्त की
Excellent.
पाबंदी के साथ इंशाल्लाह
Inshallah. Jazakallah.
इंशाल्लाह we can start now
Okay. Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. On behalf of Giving Back to Pharmacy in Pakistan, which is a volunteer organization who's working to empower pharmacists for a better health care, I, Sayyida Maima Shah, I'm a fresh graduate of pharmacy, University of Peshawar, welcome you all in a webinar on a day in the life of a nuclear pharmacist. We will start this session with the national anthem. So here we go with the national anthem.
Dr. Umaima, your voice is very low. Dr. Umaima, your voice is very low. If you can raise your voice.
Is it fine now? Sorry.
Yeah, this is fine now.
Okay. I'm so sorry.
It's okay. You can repeat because we didn't hear anything.
Okay. So today's session is on, like, we have a topic, a day in the life of a nuclear pharmacist, and for today's session we have Muhammad Manan Bhatti with us, who is a radio pharmacist at Shaukat Khanum Memorial Cancer Hospital and Research Center, Lahore, with 6 years of radio pharmacy experience. He also holds degree of BSc PharmD and MPhil Pharmaceutics. So let's start with Dr. Muhammad Manan Bhatti. Over to you, doctor. You can share your screen.
Thank you very much, Miss Umayma Shah. And first of all, I would like to thank you to invite me in this session. So today our topic of presentation is nuclear pharmacy. My name is Muhammad Manan Bhatti and I am working as a radio pharmacist at Shaukat Khanum Memorial Cancer Hospital, and I have 6 years of experience in radio pharmacy. So disclosure: I have not received any financial or commercial funding for this session. No commercial trade names are used in today's presentation. No specific conflict of interest. I have no financial relationship to disclosure, and I will not discuss off-label in this presentation. So, the main objective of our today's session is introduction of nuclear pharmacy, then radioactive decay, different methods to produce radiopharmaceuticals, radioisotopes, technetium-99m labeled pharmaceutical cold kits, similarly 18F FTG production and quality control of radiopharmaceuticals. So first of all, I will start from the introduction of nuclear pharmacy or radiopharmacy. Basically, radiopharmacy is the first specialty recognized by the American Pharmacist Association in 1975, and this specialty got the board certification by the U.S. Board of Pharmaceutical Specialties in 1978. In 1982, nuclear pharmacy became the first formally recognized pharmacy specialty in the world. So, some definitions of in this session, in the start of this session. The first one is nuclear pharmacy. Basically, nuclear pharmacy, also called as radiopharmacy, a specialty practice of pharmacy that employs the use of radioactive drugs for the diagnosis and therapy, is one of the specialty recognized by the U.S. Board of Pharmaceutical Specialties. And nuclear pharmacist, a person's responsible for the formulating and dispensing of prescribed radioactive traces or radiopharmaceuticals for the diagnosis or treatment of the disease. Similarly, nuclear medicine is a branch of medicine that deals with the use of radionuclides or radiopharmaceuticals for the diagnosis of disease. The word radiopharmaceutical comprises of two parts. The first one is radio and the second one is pharmaceutical. Radio means the radioactive material, radionuclide or radioisotope, and the pharmaceutical means the drug that is specific in action and affinity. So, the radiopharmaceutical is a radioactive compound used for the diagnosis and therapeutic treatment of the disease. So, whenever we use the term radiopharmaceutical, then a term keep in mind, that is radioactive decay. Basically, an unstable radioisotope or any heavy element, when decay, it will emit radiations in the form of three waves. The first one is alpha particle, and the second one is gamma rays or particle, and third one is proton. The radioactive decay is a process in which an unstable atomic nucleus spontaneously loses energy by emitting ionizing particles and radiations. And the radiations are three parts. Uh, three forms. The first one is alpha, then second beta, and third one is gamma rays. So in this slide, you can see the penetration power of three types of radiation. The first one is alpha particles. The alpha particle can stop with the help of only a single paper, and the beta particles can stop with the help of aluminum foil, and the gamma rays having more penetrating ability, so we can stop it by using lead. Units of radioactivity. Basically, radiopharmaceuticals is measured in curie or becquerel. Basically, there are two types of units. The first one is SI unit, and the second one is commonly used units. So, curie or becquerel. Becquerel basically is a system international unit. 1 MCI basically is equal to 37 MBQs. In this slide, we can see the radionuclides used for the assessment of organ function, detection of disease, treatment of disease, and monitoring the effects of treatment. There are three ways to produce a radioactive compound, a radiopharmaceutical, a radioactive material. The first one is nuclear reactor, the second one is cyclotron, and the third one is generator. So start from the first production method, the nuclear reactor. Basically, radionuclides produced either by nuclear fission or by the nuclear fusion reaction. Nuclear reactor is expensive method to produce radiopharmaceutical, more exposure in this area, and using nuclear reactor, we can produce beta negative radionuclides, that is moly 99M, radioactive iodine 13. And the second way to produce radioisotope is cyclotron. Another way to generate radionuclide is by a small reactor. This is also expensive method to produce isotope, mainly used for the PET radionuclide generation. PET means positron emission tomography, and this is the advanced form of radiopharmacy or nuclear medicine. And the third method to produce radioisotope is generator. And generator work on the principle of ion exchange method. Commonly used generators are molybdenum 99M or technetium 99M generator, and second one is germanium or gallium generator. Most commonly used generator is moly or technetium 99M generator. So the composition of generator, the generator consists of, moly generator consists of glass column, lead, and the needles. The half-life of technetium 99M is only 6 hours, and the energy is 140 kilo electron volt. And the general reaction of producing technetium 99M is, first of all, the mother isotope is uranium. Uranium decays into molybdenum, and molybdenum decay into the final product technetium 99. We use technetium 99M because the half-life of technetium is only 6 hours, and the molybdenum basically 66 hours. So we use that isotope which have low half-life. So for the detection of any disease inside the body, and easily removal from the body. Quality control test. The first one is alumina breakthrough test, and the second one is moly breakthrough test. Whenever we use the radioisotope technetium 99M, before labeling with different qual kits, we perform two types of tests. The first one is alumina breakthrough test, and the second one is moly breakthrough test. The limit of alumina breakthrough test is less than 10 microgram per ml, and the moly limit is 0.15 microcurie over 1 mci of technetium 99. The one example of technetium labeled pharmaceutical cold case MAA. Basically, MAA is a macro aggregated albumin, and this pharmaceutical is used for the detection of lungs function. So, technetium 99M with MAA is actually a radio-labeled, precipitated, biodegradable macro aggregate of human serum albumin. It is prepared under careful controlled conditions of pH, time, temperature, agitation, and reagent concentration to ensure correct particle size formation ranges from 10 micrometer to 100 micrometer. And the biological half-life of these particles in capillaries is approximately 2 to 3 hours. Steps to produce technetium labeled pharmaceutical cold kits. The first step is to we take a vial, check batch number and expiry date, then take a shield, then take a syringe, put vial into the shielding, aseptically injecting radioactivity into the vial, then gently shake and wait for the labeling. So these are the steps to produce pharmaceutical cold kits with technetium 99. This is the structure of lungs, internal structure of the lungs. Basically, MAA kit used for the detection of lung function, and the particles which are present in the kit ranges from 10 micrometer to 100 micrometer. So the structure of lungs, the maximum capillary size is 125 micrometer in size, and the smallest alveolar inside the lungs size is 8.2 plus minus 1.5 micrometer. Basically, the mechanism of action of this kit is when radiopharmaceutical injected to the patient, and these pharmaceuticals will go inside the lungs with technetium 99M, and the mechanism of action is trapment. Basically, the particles trap the lungs, and in a certain period of time, technetium 99M raise energy radiations, and the radiations basically detected by the gamma cameras and the photographic plate of the lung display on computer screen. Basically, there is a difference between radiology and nuclear medicine is in radiology, when X-ray passes from the body, the rays passes from the body, and the image of the body is displayed inside on the screen. But in case of radiopharmacy or nuclear medicine, body become a source and emit radiations, and the radiations will detect by the gamma cameras to display the internal structure of the body. So in this way, we can check the internal functions of the body. The adverse effects are rare, but application site hypersensitivity, chest pain in case of maybe, that is used for the detection of basically heart functions, and anaphylactical reactions also seen but rare. Commonly used radiopharmaceuticals are NDP, which is used for the detection of bone metastatic conditions, DTPA, DMSC, and MAG3. These three kits are used for the detection of kidney structure, HIDA for liver, maybe for the structure of, to see the structure of heart and parathyroid gland, and MAA it is used for the detection of lung perfusion scan or lung functions. So the main radiopharmaceutical which is rare used but most widely used radiopharmaceutical in this expanding medical imaging technology, that is FTG fluorodeoxyglucose. FTG basically is a glucose analog in which the second position of glucose molecule replaced by the fluoride atom. When the second position of glucose occupied by 18F, it will become the 18F FTG. And this is the advanced form of radiopharmacy or nuclear pharmacy or nuclear medicine department. So FTG basically a sterile solution containing 2-18F fluoro 2-deoxy D-glucose prepared by nucleophilic substitution reaction and used for the diagnosis of whole molecular formula, relative molecular mass. This is the energy is 511 keV and the half-life of FTG is 110 minutes. Basically, different steps. There are different steps to produce FTG. First of all, we have to produce a radioisotope, that is 18F, and 18F will produce by using cyclotron. By using cyclotron, FTG is a multi-step process that begins with the particle accelerator cyclotron, which produces the 18F radionuclide through oxygen 18 enriched water in a small enclosed volume, typically 0.5 to 2.5 ml. After sufficient irradiation time, the radioactive fluoride is transferred to the radiopharmaceutical production laboratory for the further transformation into the FTG suitable for injection. So in the first step, we can only produce 18F isotope by using cyclotron. In this slide, we can learn about the hot cell synthesis and dispensing unit. When the isotope F18 produced, it will collected into the FTG lab, that is synthesizer, which is placed inside the hot cells. Basically, hot cells are the specific uh, specific units which are designed to stop the radiations. The isotope will go inside the hot cell, and inside the hot cell there is a synthesizer, that is FTG synthesizer. On FTG synthesizer there are different items including IFP kit, reagents, and different filters. And after final synthesis, the drug will go inside the dispensing unit, that is Federico or Manila. So the final product FTG is collected directly into the sterile injection vial placed in the dispensing unit, which is also placed inside another lead shielded hot shell. The hot shell provides protection from the ionizing radiation emitting from the product, and also designed to provide an environment which is compatible for radiopharmaceutical manufacturing. Synthesis of FTG. Basically, FTG synthesis, the first of all, we can produce 18F isotope by using cyclotron, and in the second step, basically F18 isotope attached with the mannose triflate group. Basically, the precursor mannose triflate in which 1, 3, 4, 6 positions carbon of a mannose molecule are protected with an acetyl group and triflate, which is the leaving group at the second carbon. In this structure, you can see the mannose triflate. In the first step, 18F will attack to the second position of the mannose triflate, and In the presence of cryptophics, catalyst, and acetonitrile as a solvent, 18F approaches the mannose triplet at the second carbon, while the triplet group leaves the protected mannose molecule. The nucleophile approaches the reaction center from the opposite side of the leaving group and displays the triplet group. These types of reactions are referred to as SN2 or biomolecular substitution reaction. In the next step, the protective acetyl ester group are removed by acid or base hydrolysis, leading to the formation of final product FDG. Quality control of radiopharmaceutical or specially FDG. The final step in the synthesis of 18F FDG is the assessment of quality control and assurance. The required quality parameters are assessed with validated test methods and equipment. These are the different tests which are performed before release of batch. The first one is physical appearance, pH, radionuclidic identity, radionuclidic purity, chemical purity, Lal test, and filter integrity test. Physical appearance, according to the pharmacopoeia, product should be clear, colorless, and free of particulate matter. pH, a numeric scale used to specify the acidity or basicity of aqueous solution. According to pharmacopoeia, the pH of 18F-FTG should be between 4.5 to 8.5. And according to IAEA guidelines, International Atomic Energy Commission, pH meter is not recommended for the 18F FTG testing because of more exposure and more volume. Radionuclidic identity. According to pharmacopoeia, energy of 18F FTG should be 511 keV plus minus 5%. And we use well counter for the detection of energy. Similarly, radionuclidic half-life, radionuclidic purity. We use Dose calibrator to check the half-life of isotope. The time taken for the radioactivity of specified isotope to fall half from its original value. According to pharmacopoeia, the half-life of 18F-FTG should be 110 minutes. And we use Dose calibrator or well counter to detect the half-life. Similarly, TLC, thin layer chromatography, provides an easy and reliable means to determine the radiochemical identity of FTG. HPLC and radio TLC. To check the radiochemical purity of 18F FTG, we use radio TLC and HPLC. This is used for the labeling of isotope with pharmaceutical and percentage of byproduct in the final product. Chemical purity using TLC and gas chromatography. In chemical purity, we can check the presence of organic solvents such as acetonitrile, ethanol, catalysts including amino polyether reagents, and byproducts such as cold FTG, FTM, glucose, depending upon the method applied for the synthesis of FTG. Lal test basically, Lal test means limulus amiboside lysate, and this is used for the detection and quantification of bacterial endotoxins. The procedure is, first of all, we start with the device and
Manas, we cannot hear you. Can you please check your connection?
placed into the cartridge. Press start button and wait 20 to 25 minutes for the result. Sorry for the poor connection. So we discuss LAL test. We are discussing LAL test. So the result of LAL test is, according to pharmacopoeia, the toxins should be less than 175 and endotoxin units per ml. This is the flow chart of 18 FTG production. In the first step, you can see the production of isotope. In the second step, hot shell for the synthesis of 18F FTG. And the third step for the dispensing of radiopharmaceutical. In the fourth step, you can see the quality control of FTG, 18F FTG. And in fifth step, dispensing of FTG. Sixth step, scanning, and the last step, reporting of the diskette. Mechanism of action. Basically, glucose molecule is phosphorylated by hexokinase, which is the first step towards glycolysis. Just as glucose, FTG is actively transported into the cell by a group of structurally related glucose transport proteins. FTG, however, cannot enter into glycolysis and becomes effectively trapped intracellularly as FTG6-phosphate. Tumor cells display increased number of glucose transporters, particularly GLUT1 and 3, as well as higher level of hexokinase isoforms. Tumor cells are highly metabolically active and favor the more inefficient anaerobic pathway, adding to the already increased glucose demands. In this way, tumor cells uptake and retain higher levels of FTG as compared to normal tissues, and we can easily detect the uh, abnormal behavior of the body. Patient dose is 370 to 740 mbqs. Child dose 3.7 to 5.2 mbqs per kg. Principles of radiation protection. When we are using radiopharmaceutical, we keep in mind about these two principles of radiation protection. The first one is TDS, time, distance, and shielding, and the second one is ALARA, as low as reasonably achievable. So in this last slide, you can see the PPEs, personal protective equipments used for the used before start of radiopharmaceutical productions. The first one is TLD badges. Second one, goggle, lead goggle. Third one, lead ring, TLD ring. Fourth one is personal protective equipment. In this equipments, EPD, electronic pocket dosimeter, hand fit monitor used for at the end of working, lead aprons, which are also used before start the radiopharmaceuticals. These are the equipments which must be used before start or enter into the radiopharmacy or portions. So these are the slides which are uh, helpful to understanding the radiopharmacy or nuclear pharmacy. Thank you very much.
Thank you, Dr. Muhammad Manan, for enlightening us. It was great to have you on board. Sir, we have some questions from the audience. If you could please help them in getting
Yes.
answers. So, yeah. So the first one is that, in your opinion, what is the scope of nuclear pharmacy in Pakistan?
So fine. Basically, with the passage of time, the scope of nuclear pharmacists or radio pharmacists is increasing because in past all the nuclear medicine centers of atomic energy commission basically they are higher technologies for this purpose, but with the passage of time and the passage of time, the scope of radiopharmacists will sure or definitely increase because when they are uh, uh, exit from their job, the next personals with high experience must be hired at that positions, and with the passage of time definitely it will increase in Pakistan, inshallah. Different
Okay.
centers in the Pakistan Atomic Energy Commission already hire ready pharmacists, but gradually it will be increased, inshallah.
Okay,
Yes.
that's perfect. So there is another question, that is, what is the main responsibilities of a nuclear pharmacist in a hospital setting?
Basically, the radio pharmacists work in collaboration with technologists for the preparation of radiopharmaceuticals, inventory control of radiopharmaceutical, quality assurance of different uh, production areas, especially the equipment used in radiopharmacy. They are inspected annually uh, by the third party for the validation. So the radio pharmacist basically in hospital in collaboration with physician recommend dose for the patient and quality control of different radiopharmaceuticals. So these are the things which are
Okay, okay, that's good. Thank you. But there are some other questions. So the one is that, what safety measures a nuclear pharmacist has to maintain?
basically when we start our work, we should equip with different PPs. We basically use lead apron, dosimeter, gloves, mask. All these PPs must be used before starting the deal with the radio isotopes, and the radio isotopes basically prepare inside the hot cells, and the hot cells are the dedicated areas are dedicated parts that basically stop the radiations and save the body, save our body from radioisotope. So we use safe measures by using different containers, and different lead bricks are used and hot shells are used to protect from the radiations, and all these things basically done inside the hot cells are shielding. So in this way we can save our body as well.
Okay, so for that, do we need any particular training? Because like this job involves a lot of health hazards, so
Yes,
to the person. So
basically,
do we?
yes,
Yeah.
basically we hire a fresh at Shukatharam. Basically, we hire a fresh graduate. In first year, we deliver training how to work in radio pharmacy. After that, after that the person able to do independently all the aspects or parts of the radio pharmacy. So we train a person first in 3 months, and the whole time period will end at the end of year, and after that the trainee radio pharmacist become the pharmacist and independently handle the radio isotopes.
Okay, okay, that's perfect. So there we have two more questions. So the one is that in case of any like if any anaphylactic reaction happens, so how would you respond to that?
Yes, basically, in case of anaphylactic reaction, whenever we deliver our radiopharmaceuticals to the nursing staff, first of all, we perform endotoxin test by using LAL test. So, when the LAL test give result about the endotoxin, then we pass the batch to nursing. But in case of anaphylactic reaction, there is maybe some patients, have sensitive and if but rare in our department, then we log that reaction our online and also report to the supplier which provide us the source. So these are the steps that we are following.
Okay. Okay. So one last question. As in your presentation, you have discussed different machines. So I want to ask that how many of you have worked with, and what were the challenges you faced while using these machines?
Basically, when we are using these machines, we have a technical bits. The machines have a technical bits, and with the passage of time, we are able to manage and maintain the steps. But we have an engineer along us who supervise us as well as take care of machines. Any fault in the machine, mechanical fault or electrical fault, they basically check, inspect, and after a green signal, we can use it in routine.
Okay, so like the nuclear pharmacists have like technicians with them to help them in running the machines and all, right?
Yes, a
Yeah.
technical engineer as well as technologist.
Okay, that's perfect. Thank you so much for your time,
Welcome.
Dr. Muhammad Banan. Okay, so now I would like to end this session and would like to thank you, sir, and to thank our audience out there, coordinators, and the whole team of Giving Back to Pharmacy in
Thank you.
Pakistan. Thank you for joining us today. So I would officially conclude the session and hand it over to Dr. Umar Hafiz. Dr. Umar, please.
Thank you, Dr. Mama. Thank you, Manan. It was a very nice presentation, very detailed presentation, and we enjoyed your presentation and with lots of
Okay.
knowledge. My question, as you have mentioned, if you allow me, in the
Yeah.
last
Okay.
portion, you have mentioned that you have technologist and technical engineer over there.
Yes.
So I want to ask that while you are using those machines,
Okay.
uh, you have full orientation of that, because some part what is your part in that
Yes.
uh,
Basically,
scenario?
whenever a machine is installed inside the radio pharmacy, the engineer or in the installer instruct us, train us, and assign a certificate of training. After that, we work under the supervision of engineers, and with the passage of time, we are able to more and capable to handle in case of their absence. So we can easily troubleshoot the machines and smoothly go with our work.
Okay, that's great. And one more scenario,
Yes,
like as we have explained that there is some, if there is any anaphylactic reaction happens,
yes,
even you have performed the LAL test and you have done all the safety parameters. But if
okay,
anaphylation happens in that particular room where you are using or injecting those radiopharmaceuticals, then what are your measures?
okay. Basically, we test the test again the radiopharmaceutical or multivial which we dispense to the nursing staff. Again, we check the LAL test or endotoxin test first of all. If when mostly they are basically good for use, but whenever the doctor uh, take the history of patient, already patient have any issues, so they basically recommend medicine for for that reaction. And these anaphylactic reactions are only on the injection side, not inside the body. So easily pop up and take patient under observation for 4 to 5 hours, and after that we can discharge the patient from the hospital. And also note that particular reaction, if but rare in case.
That's great. Thank you so much for your time. Thank you so much
Welcome.
for all the organizers, and giving back to pharmacy in Pakistan team. Thank you all. Have a nice day ahead.
Thank you.
We
Allah
will
Thank
Hafiz.
you very
conclude
much.
this. Thank
Thank
you.
you.
Allah Hafiz.